presenter, and that is HealthMe, Michael Havig. Dr. Havig.
Hey, how's everyone doing? Let me share my screen here. We'll get going. So good afternoon, everybody. Thank you for taking the time to learn a little bit about how we are trying to build the rails to solve direct pay ecosystem here. I am Michael Havig. I'm a physician and founder and CEO of HealthMe Technology. So I think we all understand that healthcare accounts for a large portion of our economy. What a lot of people don't realize is that out-of-pocket spending on healthcare in our country was close to $500 billion last year. And what this means basically is patients are having to pay more and more for their own healthcare. And when patients have to pay, basically they need to shop, right? Unfortunately, despite 60% of healthcare being shoppable and 82% of patients wanting to shop for their care, fewer than 10% of specialists really offer direct pay patients, and most turn away direct payers. At the same time, over 50% of patients still pay for healthcare by snail mail and telephone. And the reason for this is medical practices aren't equipped for e-commerce. Most don't know how to retail their services. And what we do is try and bring that experience to both the patient and the physician. This market is much larger than meets the eye, and we all understand direct payers being uninsured patients, medical tourists, and others. However, the bigger part of this market are the growing group of gig economy workers who are direct payers most often, and approximately 2/3 of Americans who have insurance through their employer work for self-funded employers, where spending is over $800 billion a year, and they're looking to navigate their patients to transparently priced options. And so in healthcare, patients really are the new payers, and we need to give them the same digital experience they're accustomed to in every other industry. So at HealthMe, we really solve this problem by turning practice websites into e-commerce storefronts, which gives patients a retail experience to access transparently priced care. Patients have a familiar shopping experience like they do in any other industry. They get clear upfront pricing, easy to understand terms, and absolutely no surprise bills. And we'll serve over 10,000 patients on our platform this year alone. Works like this, very simple. Patients can select the care they need. I'm not sure if you can read that writing very well on the slide, but these are simple things, easy to understand consumer packages, a shoulder care evaluation, an elbow care evaluation, right? There's no CPT, ICD-10 codes or unspecified diagnoses that appear there. Once the patient selects the package they need, they can select the provider, and then they purchase their care, right? They pay in advance via simple marketplace checkout page like we see in everywhere else. We collect the money, hold it in escrow, and disperse that payment to the provider on the day of service via ACH or virtual credit card. And so by doing this, we're really empowering patients to know the true cost of their care without fear of surprise bills. And this is really important because about 40% of Americans put off needed care due to perceived high costs. When they delay care, they end up in the emergency room, costing themselves and the system more money. And worst of all, they don't get the good health care that they need. So we're also bringing access and equity to healthcare. About 70% of our patients are uninsured, and we give these patients access basically to the largest and most sophisticated orthopedic practices in the country right now. And on the provider side, we really are like a Shopify for healthcare, where we teach doctors to retail so they're not missing this business. By doing this, we streamline the billing collection process, reducing costs for the practice by over 15%. And we're currently generating over $50,000 of revenue per physician on the platform. This is incremental revenue that most were turning away. And we're doing this by giving them a turnkey product. We have over 400 musculoskeletal bundles currently. We have proprietary pricing guidelines based on what patients really will pay for healthcare, as well as national and regional data from other databases. And we're just really giving them a comprehensive solution. And as I said, the business flow here is patients pay in advance. We hold the funds in escrow and pay the practice at the time of service. In addition to growing revenue for the practice and giving patients access to care, we help make them compliant with the new good faith estimates laws that went into effect the first of the year. Most medical practices, many folks I talk to don't even know this exists, but it is law and it's punishable by up to $10,000 per violation if you can't give a patient a good faith estimate for the care if they request it, right? And so we're able to drive compliance and revenue and access to care. We are a B2B2C company. We drive revenue in three ways. We have a commission on all transactions, in the percentage varies based on the price of the package. We charge a monthly subscription to our users, which averages about $3,500. And again, this is also based on size of the practice, which is why it's an average. And then setup fees, which are tiered again on the size of the practice. Really, our process is repeatable and scalable. So we have just over 500 physicians on the platform currently, about 1,000 providers in total, if you include physical therapists, PAs, nurse practitioners. By year end, we'll have over 1,300. And by year end next year, we'll have over 3,200. We're also really excited about enterprise partnerships we're developing. And so we're working with large imaging centers, patient intake applications to streamline that process for self-pay patients, surgery center companies, physical therapy companies, and we're even talking to large players like Zimmer Biomet, who are looking at a solution like ours to bring consumerism to healthcare and to help work with their surgery center partners to serve the growing numbers of outpatient musculoskeletal procedures. Developed a deep team with a lot of experience, not only in healthcare, but also marketplaces and SaaS. And what I'm really excited about is we really have created a network effect here. And this has now been proven over our time in the market. So as we grow more providers, this attracts payers. So we're currently working with direct payers, self-funded employers, the TPAs and navigators that drive this care. And as more payers push more patients through the platform, patients learn about it. More patients means more providers that want to be on the platform, and so on and so forth. And at the end of the day, we're really building a market network that connects patients, providers, and payers. Currently seeking to raise $3 million to help scale the platform. Our goal is to reach 4,000 orthopedic surgeons with this. We're looking to grow into other specialties and are already talking to dermatology groups, GI groups, and ophthalmology. We're currently working on partnerships to kind of navigate more of this care to our clients. So we're working with TPAs, brokers, nurse navigators, and others in the direct pay space. And at the end of the day, this is kind of a win-win-win for patients, payers, and providers. Our platform allows incentives to align for these three parties. When this happens, we make healthcare shoppable, like everything else today. And in the future, if you can shop for healthcare, and you can currently do it actually on our platform, but transparent pricing really can inform patient and payer decisions as opposed to showing up at a very expensive option like in a hospital emergency room. So at any rate, that's all I have today. Hopefully I was able to end a few minutes early, and I'm happy to field some questions. And reach out to me if you'd like after the meeting. I'd be happy to talk some more.
Thank you, Michael. Great presentation.
Thank you.
All right, let's go back to, let's see, Dana.
Hi, Dana.
Hey, Michael. Great presentation. Thank you.
Thank you.
So, there's many of those in the market now. This is the new trend. I'm curious, how do you guys stand out against everybody else's out there?
So that's a great question. What most other companies are doing, the MD Saves of the world, the Sesames and others, they're really building an Amazon for healthcare, if you will. That's what I started doing, and I think they're having a hard time to some degree of acquiring providers. They're spending a lot of money to do that. What we're doing a little differently, instead of going after the demand like they're doing, marketing to patients and hoping they fill in the supply, we're building the difficult side of the marketplace first, right? So we're building supply. And the way we build supply is we give doctors access to a group of patients they're missing. That drives a lot of revenue, and that allows us to grow our marketplace. So really the only company that I'm aware of that's giving the doctors a Shopify-like experience, basically. We're putting our solution directly on their websites so they can serve their patients. Our workflows are being ingrained in their practice management. And really we're becoming like a job essential tool for all these practices to deal with self-pay. So we're really serving the providers initially. And by giving the providers the ability to retail their services, then the patients come to that market, right? So we're just going back at it a little differently.
Yeah.
We've had great success doing that. We're also focusing on the specialty market initially. I'm an orthopedic surgeon, but that's not the only reason we're musculoskeletal. Musculoskeletal is one of the largest spends for 19 to 64-year-old workers in the United States. So this is a solution employers are looking for.
And that's the angle that I like, that you guys going with the specialties. I think that is a good approach to it. And then I think you mentioned 70% of the patients are uninsured today on your platform. And is that just part of your rollout, and eventually you'll push out as you develop more partners, I assume?
Yeah, I built the platform really to serve uninsured local people. I mean, I started the company because I practice in my hometown. A lot of my friends, folks I grew up with, are small business owners. Some of them don't have the money to afford insurance. And the ones who do have the money, they don't want to pay 30, 40, 50,000 a year out of pocket for premiums and deductibles before they hit their benefit, really, right? So these folks are self-payers. I learned I was turning them away, even though we had cash pay pricing, written on a piece of paper somewhere. These folks would call me out. They'd call me at home at night. They'd text me and say, Mike, I tried to get my kid in to see you. Your staff turned me away. And I felt terrible. Like they thought I was greedy. You only see insured patients. That's what my staff told them, right? Because my staff didn't know. I've never taught my staff. We had a piece of paper, like I said, but all we do is teach our staff to really bill from third parties, right? And it's a hassle for them to predict the future. If your services aren't bundled, nobody knows what exactly you'll do when you see the patient. Will it be 5 minutes? Will it be 50 minutes? And so it's impossible for them to put a price on it. So really the only way we can prospectively price healthcare, which I think where everybody wants to be, is to bundle it. And think outside the box a little bit. It doesn't matter what CPT or ICD-10 code is assigned to my care. At the end of the day, the patient has a job to do, right? In the words of Clay Christensen, they hurt their knee, they need a checkup, they just want to be taken care of. They don't care if you spend 15 minutes or an hour and 15 minutes or this, that, or the other thing, right? And so, at any rate, that's the initial market we're serving. And we've kind of fallen into this other market, really, of, right, these payers find us, right? And they want to start referring business to us. And really, that's probably the bigger business opportunity, if you will. But the direct payers we're serving now actually generate money for the practices and our company and give those folks access to care. So.
Thank you.
Sorry, that was a long-winded answer. I tend to get on my soapbox a little bit sometimes. So,
Passion is good.
Doreen?
Yeah, I'm curious, is there a specific vetting process for the physicians you're engaging? And what would that be? How does it look like?
So right now, I mean, how do you measure quality in healthcare? I mean, it's different. I think, it's difficult, right? There's a lot of different ways people do it. Is it patient ratings? Is it CMS quality metrics? Is it, utilization metrics? And I think it's all those, right? It's a Venn diagram. The patient's quality for the patient's one thing, for the provider's another, for the payer's another, and they all overlap somewhere. Currently, we've talked to a couple of companies that measure quality, the Embolds and the Quantroses of the world. I think ultimately those kind of partnerships could do that. We do ask for patient feedback and ratings, but as many people criticize those because they're really more vanity ratings, I think. And the practice serves good coffee and has a nice looking waiting room, they get higher ratings. So at any rate, that's a great question. And those are the things we're looking to do, probably partner with a third party that measures that better than we can. Most payers and others, and I'm not talking about the local patients that we serve, who we need to get quality metrics in front of, but a lot of the payers in the space, in the direct pay space, already have quality metrics they're using to vet physicians. Now, who do we onboard? Currently, we're focused on large, sophisticated, well-established practices, right? So these are large independent practices working with the large 135 doc practice in Virginia. We're talking to the biggest orthopedic group in the country, biggest group in California, right? So these people really are pretty good about at least vetting quality on that side as far as being board certified. They kind of police their own. But there is certainly a better way to do it that we hope to incorporate in the future.
I totally agree. For the patients then to navigate that landscape to identify actually what is quality care, it's very important. So then if you want to put the patients in the driver's seats, that is one of those things we have to answer for them and translate for them.
You're
Thank
right.
you.
Yeah, the translation piece, that's one thing I really don't touch on, and I should more. It's one of the strengths of our platform. It's extremely consumer centric, right? It's not, I mean, it's just my knee hurts at my knee visit. I need whatever, right? Our surgery packages are bundles of CPT codes. They're not individual CPT codes. They're, again, just doing the job for the patient versus trying to part out all these different things that nobody understands.
Thanks, Michael. Vince, do you have any questions?
Yes, I have two quick questions. The question number one would be, when you mentioned in one of your slides that billing and collection is greater than 15%, how do you come to that number?
So there's a study that was published in JAMA in 2018. It was done at Duke along with Harvard Business School, but they looked at the actual cost to collect from a commercial or even Medicare from an insurer basically. And it was a very granular study, and they found that the cost to collect from an office was 14.5%. At a surgery center, it was 13.5%. And there's other studies, McKinsey and others I know that have talked about costs of look at the administrative side in addition to billing collection, where just to get those bills out and hire the staff, it's upwards of 25% or even higher.
Okay. And a second and last question would be, when you mentioned the 3,000 will be your average ticket size depending on the size of the practice, what would be the minimum and maximum?
Okay, and just to be clear, that wasn't the ticket size, that was basically our subscription charge. So our minimum annual subscription is $1,500 and it goes up to $5,000 based on the size of the practice. So less than 5 doctors is the lowest tier, 5 to 15 doctors is the next tier, more than 15 doctors is the last tier. And it's not per physician, it's per practice. So we think we're pretty reasonable there.
Yes. And what's the sales cycle look like?
To onboard the practices?
Yes.
Yes. So it can vary, right? So our fastest onboarding from meeting a client to having them up and running was 2 weeks. That was about a 14 doctor practice in Virginia. There's also practices like, you know, the greater than 100 doc practices. We've been talking to the largest orthopedic group in the country now for just about a year, and, you know, done all the board and the executive committee and the legal reviews, tech reviews, and we're finally going to get them up and running, hopefully this quarter. So those are the two extremes. Most our goal is to get people onboarded in 6 weeks, from initial meeting to onboarding in 6 weeks, and we're pretty good at doing that.
Are you using your own internal resources, or do you have a sales team for doing this?
Yeah, so that's kind of interesting. I mean, part of the reason we're raising the money is to grow our sales team. Right now, most of our growth is organic, and it's word of mouth almost. I mean, I've kind of become, at least in the orthopedic community, musculoskeletal space, kind of the resident expert on transparently bundled healthcare. So I speak at a lot of meetings, MGMA, all the orthopedic meetings, things like that, right? And a lot of it's word of mouth. So we get a group. We're working with a lot of large groups that are part of a business consortium called the Ortho Forum. And we get one Ortho Forum group on, the others in the region want to join.
All right.
So it's all, right now it's organic.
Thank you.
We need a sales team.
Thank you.
Thank you.